Welcome to Did You Know, a new series by Partner Veterinary. In this series, we will explore all things veterinary medicine and all things partner. In each episode, we will answer some of the most common questions we are asked. From neurology to emergencies and everything in between, if it happens at Partner, we'll cover it. Speaking of neurology, first up is Dr. Casey Neary, neurologist and neurosurgeon. Dr. Neary will discuss common misconceptions about neurological cases and give us some insight into what it takes to become a veterinary neurologist.
My name is Dr. Casey Neary. I'm a board-certified veterinary neurologist and neurosurgeon. I practice with Partner Veterinary Specialty and Emergency in both Frederick, soon to be Richmond. I'm from Atlanta, Georgia. Did my undergrad at Auburn University, War Eagle, and I did my vet school at the University of Georgia, did some postdoc training at Cornell, and then did my residency in the DC area. And I've been a veterinary neurologist for 14 years.
So first question, how does one become a veterinary neurologist?
Yeah, it's a good question. On average, it'll be about 13 years, for your standard veterinary neurologist or veterinary specialist to achieve that goal and achieve that certification. It takes 13 years from when you finish high school until you become a working neurologist. And so that's 4 years of undergrad, 4 years of vet school, a rotating internship, a neurology internship, and then a 3-year residency in neurology and neurosurgery. So it takes a lot of schooling, a lot of time. And then to become a neurologist, you end up having to pass 2 tests, one after the second year of your residency and the one after the third year of your residency. And you get 5 years, I think, to pass both of those. And once you do that, you are a board certified specialist, or in my case, the board certified neurologist.
A big commitment.
It's a huge time commitment. It's a financial commitment, meaning that your cohorts in vet school will go straight into working in practice right after vet school. And I did 5 extra years training with an intern and resident salary. And, you could guess that's probably not as good as a regular veterinarian.
Right. Are there a lot of neurologist positions available in the country?
Oh, yeah. It's definitely a mismatch between the supply and the demand. I think there are a lot of specialty hospitals that want and need veterinary neurologists, but there's so few of us, we're talking in the span of, a couple hundred for the country.
Wow.
And so it's a small number. So there's more hospitals in search of neurologists than there are neurologists.
What would you say are the most common conditions seen by a veterinary neurologist?
2 conditions that stand out, and one would be a brain condition and one would be a spine condition. Brain condition would be epilepsy, which is basically the definition of that is recurrent seizures from an unknown cause. These animals have a normal brain MRI. They are normal dogs, and they just happen to have a seizure condition that is likely genetic or inherited, and and that does require seizure medications. And so epilepsy is very prevalent, in terms of the symptoms that I see as a veterinary neurologist. So that would be number 1 or 1A, and then 1B would be a disc-related problem. I used to say that was the most common thing I saw, but I think it's probably 50-50 with epilepsy. But dogs have disc all the way from C2 actually down into their tail, and cats as well. And so we see a lot of problems with them when they cause symptoms like pain and weakness and wobbliness.
For older dogs, a dog who has gone all its life without seizures, can an older dog all of a sudden start having seizures? And is that epilepsy, or is that something that is more neurologic, like brain tumor type situation, or is that a bigger question?
That's a good question. And that could be what I would consider one of the big misconceptions of animals with seizures, is that every old dog that has seizures has to have something bad, something malignant. And that's just not the case. There is a late onset epilepsy, where meaning that we have a dog that is, say, older than 6 that has a new onset of seizures and we don't find an underlying cause, we could continue to not find an underlying cause with them, and they have normal exams, they live normal lives, they just have a seizure condition just like a, more standard epileptic would. But I think that's one of the big misconceptions with seizures is that, especially in older animals, give the disclaimer there, the older population, meaning 6+ that has seizures, they do have a higher tendency and a higher predilection for having, things like brain tumors and strokes. But I think one of the misconceptions is that every old dog that has seizures has to be having the seizure secondary to something bad, and it's just not the case.
Are certain breeds more susceptible to neurologic disease?
Yeah, I mean, we used to joke that, for every non-dachshund that I would see as a neurologist, I'd see 40 dachshunds. And that I thought would hold true forever. And then the French Bulldogs came and they kicked in the door. And the French Bulldogs, they have taken over my number one breed. They're not picky on where they like to have neurologic problems. It's just not just a back or neck issue like the Dachshund tends to get. French Bulldogs will get, neurologic conditions affecting every aspect of their nervous system. So French Bulldogs, Dachshunds are going to be, very, very high top 5. But I'd also put in Shepherds and Boxers and, Labs to some extent. There's certain breeds that are predisposed to certain conditions, but I think overall those would be probably the top 5 that I see as a neurologist.
And does size of the dog matter?
I tend to see more primary nervous system cancer in larger breed dogs than I do in smaller breed dogs. Apart from that, the sizes of the animals, they seem to get conditions pretty equally distributed throughout the size range.
What is the biggest misconception about seizures?
That old dogs, when they're having seizures, that it has to be something bad, and it's just truly not the case. And also that by looking at a seizure, violent seizure versus a very mild one, that somehow the severity of the phenotype, the severity of what we're seeing played out with the seizure somehow has some bearing on the malignancy or lack thereof of the underlying condition. And that's not the case, because you can have animals with epilepsy have horrific seizures and multiple and ones that are very violent. And then you can have dogs with inoperable fatal brain tumors that can just have a very faint, twitching side of the face or, things like that.
Will an epileptic dog need to be on lifelong seizure medications?
Well, it really depends. Personally, I like to see an animal go 12 months seizure-free before I consider taking them off of the medication. It's also important to know, and what I try to set up in terms of expectations with the families I work with is, I'll ask the family, what do you think the odds are that if I put your dog on a seizure medication, what do you think the odds are that he will never have another seizure after that? And a lot of people, I think they answer with their heart and they answer with what their expectations want to be. But it's really more like 85 to 90% of dogs with epilepsy will continue to have seizures despite a medication therapy. Most canine epileptics will need to be on lifelong medications. Now, a cat, though, is very, very different. Cats always like to be different when it comes to veterinary medicine. Cats can have seizure freedom in up to 45 to 50% of cases, meaning that you treat a cat with epilepsy, that's having seizures, you treat them with a seizure medication. Sometimes up to half of them will never have another seizure once they get put on the medication. So,
okay.
But it's
very
also
different.
about balance. Yeah, they're very different, but it's also about balancing not only the seizures that the animal is having, it's the medication impacting their bodies, impacting their quality of life. Because if it's a medication that you couldn't even tell that the animal was on, has no side effects, no organ system damage, and they've gone a year seizure free, I approach it as the old mantra, if it's not broke, don't fix it. Because we know that this medication is doing something. Do we want to try getting off of it and risk seizures coming back? Or do we want to just stay on it because it's not hurting anything? And so the way I think about it is that's a good problem to have. It's a good problem to have is if we're sitting face to face 12 months down the road and Fluffy hasn't had another seizure, we've got a good problem, and this is,
Yeah.
it'll be a stress-free decision-making process.
I know I've heard that epileptic medicine sometimes changes a dog's attitude, and makes them kind of drowsy. And does that just depend on the dog, or does it depend on the medicine? Are there different medicines that you can try?
Yeah, exactly. So it depends on the dog, depends on the age of the dog, the metabolic rate of the dog, depends on the medication, really, because there are some medications that notoriously have some side effects. Side effects, maybe client perceived side effects, or side effects that are noticed at home, like phenobarbital and potassium bromide. But, there are, what I would call newer generation, but I've been saying newer generation for 15 years now. I'll just say newer. Seizure medications that have much less side effects. You can literally have a dog on this that you wouldn't even know. You do blood work on them, you hang out with them for a week, you wouldn't know any difference. So, but sometimes it's a trial and error thing. Sometimes, while one medication in one dog produces lesser desired effect, regards to seizure control or side effects, you can give that same medication to even a littermate or another dog of its same age and breed match, and they move on with their life and there's no issues. So sometimes it can be a balancing act, and sometimes it's a trial and error situation to where you're, trying different medications to make sure you're getting the highest amount of benefit out of it, but the lowest amount of side effects.
Thanks for listening to our very first episode of Did You Know? Be sure to follow us on social media to stay updated on upcoming episodes.